For me, when I first heard of Luna, one of the things that kind of shifted my mindset in regards to what it is just it's kind of different, and that I had this aha moment of like, oh, this is something that's going to maybe change the game in the world of like physical therapy. And I suppose, did you have a moment for yourself where you're like, oh, this is something that I really want to get on board with, to perhaps shift the way PT is going?
It's a great question. And, I feel like things come across in our lives pretty naturally sometimes, and they are in front of us, but we don't really recognize them. So I feel the transition for me, I don't think it was an aha moment, but it was surely an opportunity and a platform that needed to be shared with a lot more PTs and a lot more patients to have access to it. So, more than anything, I think that in this world, there is a need for change. And that change came in front of me, and I was definitely on board with bringing change to the PT industry. And I think having the right people, having the right leaders, having the right group of people wanting to make that change is what, is important, that you are amongst the right people to make that change to the industry. So I think more than an aha moment, it in fact feels like, how come there wasn't something like this that was done before? Everybody kind of thinks of that. And that's what's the beauty of this, which is everybody felt the need, and we were in the position to actually, suffice or fulfill that need. So I think that was the beautiful part of it, that we knew we needed this and we just needed to go do it. So I think Luna's just going and doing it.
I've certainly had a lot of patients say the same thing, where they're kind of just like, oh, I don't understand how this wasn't a thing before. And
Yeah.
it's fantastic that it's happening. And you're a physical therapist yourself. And I suppose, was there things that you were seeing in your career as a PT that you knew needed to be changed before you found Luna?
Um, Absolutely. I think we all live our everyday patient care day and say, I wish I could do better patient care. I wish I could do more patient care and worry less about other things that I didn't want to worry about. And I think that was very fundamental when we started with thinking about the therapist experience at Luna and making sure that therapists shouldn't have to worry about things that they don't have control over. And that shouldn't really be reflecting our productivity as a therapist. So how do we help optimize and enjoy, like, create an environment that really we enjoy doing what we have been trained to do? So I think that was definitely something I lived every day, and we all have things that we don't like in our days as a therapist. And Luna's working on incorporating all that feedback to make it a better day for a PT.
Yeah, I couldn't agree more. And I think Luna, I mean, it's growing more and more. So obviously the popularity is increasing, because when I first started, I think it was like Los Angeles, the Bay Area here, Seattle, and I think they had just started in Chicago. And so now, I mean, we're kind of everywhere now, which is fantastic to see. And I think it's providing a different outlet for PTs to do one. PTs who perhaps work full time at another clinic and they want to start doing something else. It's kind of like a segue into part time work on the weekends. But also, if, like for me, I've been doing it full time, and it's allowed me to have a lucrative schedule and also provide quality one on one care that perhaps isn't always happening, because the first clinic that I ever worked at, it was seeing like 2 to 3 patients an hour. And not that it wasn't effective, but it certainly, I think the quality wasn't there like it is with Luna.
That's so fantastic to hear, Michael. And I agree. I think you're a wonderful story to share yourself, right? I mean, what's important as a therapist, we have so much potential to share with the world. And especially today, we are all so creative in how we leverage technology, right? So if you want to spend some time to unleash your own potential, you need that time. And a traditional work environment doesn't allow you to do that. So how do you not spend a strict 8 to 5 or 8 to 6 kind of a day at work and actually be able to study for your OCS or study for, your progress in your career path and wherever you want to go? So I think definitely having flexibility, having independence in the approach of your care, having a good earning potential, so that's not a compromise. And then, having technology and being data driven, I think all of those were really important for us to provide to our therapists on the platform. And I think you're a great example. Like, you've started this podcast, and I don't think that our brains have the capacity to do that with a standard 8 to 5 job. So
Yeah.
and I think, as a quick background, like, I started at Luna from Stanford, and I was working full time. And I think that I joined there because I wanted to provide high quality care. But it wasn't easy because I was having two little kids, and but I still didn't want to give up on outpatient orthopedic care, and I said, "Hey, I need to keep growing as a professional. So I'm not going to choose an easy route." And I chose working full time at Stanford. I learned so much, but that's not possible for all of us to do. What if I had chosen an easier route and I would have drifted away? So
Mm.
a platform like Luna gives you the opportunity to do outpatient orthopedics with the flexibility so that you can still have some work life balance and still have maintained that earning potential. So I think creating a platform that fits us, to do
Yes.
what we want to do.
And the work-life balance becomes more and more important, especially as the field of physical therapy is changing constantly, and more providers are starting to push more for the matching what we do and getting paid for that. And I guess right now you're the head of clinical services, and you're also one of a co-founder at Luna. And I guess did you start in that role after Stanford, or did you start like practicing as a physical therapist with the Luna platform?
Great question. Well, I definitely did the first 20 visits on the platform to make sure that this is going to work and how it's going to work. It's come a long way. So yes, I did start at as the head of clinical services at Luna, one of the first few members to join the team, so a co-founding team. And yeah, I mean, I think all things clinical has been what I brought to Luna. And I think a culmination of the therapist experience being the voice for a PT, where we want to see things, how what are the most meaningful things to a therapist, what's going to keep us happy on the platform. I think all of those were really important, in pieces of inputs that I could bring. And so I think, how do you do that with developing and participating in this amazing technology that Luna has built, and going from there to ensuring quality. We now have about 1,000 plus therapists on the platform. So I think it's just unimaginable the amount of things that can come in front of you. And I
Mm.
think if you have that attitude of, okay, let's figure this out, I think you can definitely enjoy that kind of environment where there's just enough to do and you just got to know how to get it all done. So it's pretty awesome.
Yeah, and as head of clinical services, I'm sure delegation and execution must be like at the forefront of being successful in your role. And were there adjustments in like maybe learning how to do that when you first started, from changing from your role as a Stanford PT?
Of course. I mean, I think leadership skills are something you are going to evolve for in throughout your journey, but definitely I think innately as a person, what's important to you, your values are really, really important, right? So your values drive you in figuring out, okay, how do you solve the problem in front of you. um, Absolutely, having the right team members is important. So collaboration, communication, ensuring that you hire the right people to actually be able to delegate something to them. I
Mm.
think it's been a beautiful journey, definitely a growth opportunity for myself. I hadn't done anything like that before. So I definitely think that it's a big trust component. It's an amazing teamwork opportunity. I think that the needs just excel when you're going through a growth and a scaling mode to across all the country throughout the country. So I think that the soft skills are an ongoing journey. I don't think anybody's perfect at it, and the skills just you have to keep up with that. But I think the most important thing is the attitude. Are you liking it? If not everybody likes to be in that role. So what do you want to be, and what do you want to pursue is what's important for us to answer. So yeah, I think that it's about listening to yourself.
Yeah, and overall, I think just maybe for people who aren't sure exactly what Luna is, and we're going to get into the specific details, but maybe in the simplest form, how would you describe Luna? I mean, it's a physical therapy platform, it's software, but it's kind of encompassing many things. So I guess in simplest terms, how would you describe it?
Yeah, great question. So Luna is a leader in on-demand outpatient PT at home. And the most important thing is our vision is to reimagine the physical therapy experience for patients, for therapists, for physicians, and for our health system partners. So the experience is driven by the technology and the operational efficiencies that we bring in. But at the same time, the 1,000 plus therapists, the high quality PTs on the platform are definitely the PTs that are delivering high quality care. So quality combined with reimagining that physical therapy experience are definitely the focus for the company. We are providing outpatient in-person care, so we haven't really dabbled into telehealth too much. We only have less than 1% of our patients that receive telehealth visits today because patients want in-person care. Patients want care outside the four walls of a clinic or outside the hospital system. So Luna has actually, in this year, had some amazing health system partnerships, and how we've helped drive health system and orthopedic groups to bring care outside the clinic while delivering high quality care through exceptional PTs is absolutely something that we think we're doing great.
Yeah, I've seen more and more companies come out with telehealth related software and things of that nature, and I think it's good because it improves accessibility. But at the same time, I think with physical therapy, it's such a personal thing, right? Like when I go to a patient's house and I see them for whatever injury, I can tell them they could do this exercise like right there, and I can see their home environment, and I can see what their day to day looks like. And I think with one-on-one care, especially in the physical therapy realm, I think that's going to still be needed more so than the telehealth stuff. Because I did telehealth for a brief period of time, like during when the pandemic first started, and there was still some like struggles there. And so I think with Luna and the ability to do it at home, I think is going to be more important, and at least a leader more so than like this telehealth kind of direction people are starting to go in.
Yeah, and I think that every solution has its pros. So, what did Luna find as its really important problems to solve? So, when we started doing some analysis, it was identified that a patient that actually goes into a clinic, 70% of the time, patients don't complete their course of care. So we also know patients that go to for in-person care to a clinic can have challenges. And if 70% of your patients don't complete care, they're not returning back to full function and the most efficient them, right? The second thing we analyzed with one of our health system partners was that when you go to a clinic, 87% of the patients that go to a clinic for outpatient PT can actually be seen at home without any issues or without any lack of progress, and without compromising quality. So if patients can be seen at a clinic and at home with similar outcomes with great quality care, then why not have them start receiving care sooner? So access is another most important thing that I think Luna is doing great at, is improving access. Patients don't have to pay extra co-payments. They're getting care anywhere from 6:30 in the morning to 9:30 at night. So why stop them from receiving care just because they have to go to a clinic? Why not receive that same care at home? And then the last piece was identifying and surveying our patients. And we saw that 63% of our patients that were given an option to do home versus in clinic, they chose home and they wanted the care at home. So I think just knowing all of those pieces, we know that patients want in-person care, especially with physical therapy. If you want to think about scale, yes, you want to think about a generalized program for everybody, and telehealth definitely helps guide them. But at the same time, providing that in-person skill that physical therapists bring, how do we do that? Continue to bring that in-person model and not take that away from us, which we're good at, the
Mhm.
skill set that we bring with our hands and our eyes. So definitely it's been something that, as you just mentioned, we don't want to take the in-person aspect away, and just bringing them at home, I think has really helped patients get what they need.
Yeah, and it seems like it's very data driven. And I guess how has Luna adapted over the past couple of years into implementing data into care at Luna?
Well, I think that it's a question more for physical therapists. How did we incorporate data? Because too, Luna is actually a technology company. Luna today has really robust applications, right? So as a therapist, you have the entire clinic in the palm of your hand in your phone, right? And so how does that application allow you to deliver care with everything that you need, from what you need to review for your patients to actually doing care, and then aftercare, providing exercises and following up and chatting with your patients. So Luna's always been a technology and a data driven company. How do we leverage that data and help make that consumable by us as therapists is what's key. So I think that's been an amazing aspect, which I feel super passionate about, is sharing more data with the therapists and with everybody. If I knew how I was doing on certain things, then I would want to improve that. But the problem is we get that in our quarterly reviews from a supervisor. It feels like a lot of pressure. So that's more that's a very different kind of a feeling. It has a different stress. It has a punitive kind of language to it. So what Luna wanted to do is, hey, this is what your contributions look like. This is how you do in your clinical leadership goals, in your metrics, in your, engagement metrics, your patient satisfaction metrics. And if you see yourself in the red or the yellow, you want to become a green. So I think what was key for Luna is to share absolutely the data that we collect, make that available to our therapists so that we can have better engagement and better visibility from our PTs.
Yeah, and for everyone listening, when you're on the platform as a physical therapist, you have an app, and there's a certain section that you can see all your data. So you can see discharge, like frequency of discharges, exercise adherence. How many patients. Now I think cases are on there as well, and all this data that you can kind of look at to see like how you're not how you're doing, but like what your weekly and monthly progress is in regards to your care. And so it's helped me in at least understanding like, okay, this is how often I'm discharging patients, or like this is how many patients I'm starting to see, or and it's good feedback immediately, so that way you can change immediately in case you're doing something like, oh, I didn't know that I'm only discharging 20% of my patients at a lower rate, or I'm discharging people at a higher rate. Maybe I'm doing something right, or maybe doing something wrong. So it's just more data is always good to know, and just being able to apply that to your care immediately has been very, very beneficial for me.
That's great to hear, Michael. And, I think even as the future of physical therapy, for all the PT providers listening, right, we're going into this value based payment system or value based care model. What does that really mean? Every provider's outcome measures are going to be critical. Like, are your patients improving in pain? Are your patients improving in function? And so, what we've done at Luna is try to take the burden and the hassle of remembering what progress form I need to give my patient, what intake form I need to give my patient. So having a streamlined process for that, where the data collection is kind of streamlined, but you as a therapist can pay attention. Is my patient really improving in pain? Is my patient really improving in function? And what percentage of them are improving in pain and function really defines your quality of care. Objectivity is everything, right? That's how we can kind of share how we're doing with our patients. So that's another component that's so critical at Luna to bring high quality care is the intake and progress form data collection. And I think every therapist has the ability to look up how their patients are doing, and are we doing good? I think it's a great question to ask ourselves
Yeah,
to
for
improve our
sure.
value, right?
Yeah, and I think for the NACE, one thing I thought was interesting, because I've had a couple very some patients in the upper 90s, and I can see that some people would be like, well, what about the people who can't fill out the form? Well, you thankfully can go and fill out the form with the patient in front of them, so that way they can understand the questions, just how you would do it in a clinic. And just there's no significant difference where like, oh, it's on the phone, I don't understand. They're kind of just like, you read it to them and you have them answer the question in an objective way, so that way they can continue with progression. Because again, yeah, sometimes old people aren't going to be able to understand the technology, but you can be there as a liaison to kind of integrate, okay, this is how this is done, and this is how we need to track your progress moving forward.
Yeah, fantastic. Exactly. I mean, that's the idea, that our patients don't have to have the application. Therapists are definitely using the app, the Luna app. But, as therapists, for us, that data is important, and we almost can make it a reassessment process, right? Those outcome measures are to assess movement or to assess function. We can make that as a part of our progress visits and reevaluation processes. So, yeah, great. Thanks for sharing your experiences, Michael. This is fantastic.
Yeah, of course. And we're talking about data, which has also been important. But another thing that's unique about Luna is the adoption of verbal documentation. And I suppose, was that always the plan in regards to documentation, was like going to this verbal approach? Because I know it's been a game changer for me, and there's some like ups and downs about it. But I guess for this, has this been something that like initially was like, this is what we need to do?
I think documentation, like, I think the most important thing was how do we leverage technology to solve these problems, right? So honestly, it comes from my poor experience. I was always behind on my documentation. Oh my goodness. I'm like, I need to go home. I have kids to
Yeah.
take care of, and I love my patient care. So honestly, all of us live that kind of pain every single day. It is a known burden of documentation. So we really wanted to make it convenient. We really wanted to make it easy. Transcription is out there. That's not a problem. But how do we make it available to all the 1,000 therapists on the platform at no cost to you in a very seamless, streamlined manner, right? So something that took me 20 minutes to write down now takes me, 6 minutes or
Right.
5 minutes. So it's literally something that What is auto charting? Auto charting is basically where you go see your patient, you leave their home, you finish your session, right? And you get a blue button that you click and you get an interview call. You complete an interview. It's a SOAP note based format of an interview. You provide your inputs, they're fresh in your mind. You have the ability to jot down a few things if you need to, but you're basically saying it out loud. And there is this magical team behind the scenes that creates your chart, makes it ready for you, formats it, cleans it, audits it right away, and tells you if something's missing, something's not missing. So it's magical. You interview, the chart's ready for you. You look at it, you edit it, and you sign off if you want. And the best part is you get paid right away for that visit too, right? So I think it's just about leveraging technology to make us do what we do best, which is patient care. So I think that fundamental thought was there from the get go. We definitely started with like the old days are things you don't even want to remember. But we started with iPads for everybody and we created these templates. And some people like the templates, some people don't like the templates. Things were too templated, and we've all lived that in the clinic, and we absolutely didn't want that at Luna. So we said, hey, you know what? Let's make it magical enough that you can do it even between your two visits when you're driving from one place to another. So definitely an evolution, but something that came around very quickly. We knew we didn't want to do it the traditional route for sure.
And one of the other beneficial things is that front desk. I feel like I have it at my disposal. The documentation side of things, like you said, you have these people who are like auditing your documentation to make sure things are good, or progress visits need to be done, and or for direct access patients, it said, hey, we're approaching this deadline where we need to get another physician's referral, and they haven't signed off on it. We need to make sure like you can't see them anymore unless they get that sign off. And so I think that front desk aspect has been really good and made me feel confident in I'm doing the right thing. Or because sometimes if you don't have any communication, you're like, well, I don't know. If you don't have any communication, you have no idea what's going on, right?
Very true. I agree. I feel like we wanted it's literally like thinking, Michael, you run your practice, you have your patients, and you
Mhm.
have an entire administrative concierge team behind you, right? And the concierge team comprises of scheduling needs, clinical needs, communication with the physicians, protocols, escalations, anything you need. And you have that concierge team supporting you. So that is a very integral part for our therapists to be successful being out there in the field. Our goal is not to compromise on patient care and what your needs are to provide the right quality care. So it's really critical, and it's important that there are workflows to ensure we're staying compliant, we're helping deliver high quality care, and that you feel fully supported when you're doing exceptional work out there. You need a team behind you, and we definitely feel very excited and proud about our concierge team.
Yeah, just to go into the details, if in between patients, what you can do as you're driving, or at least in between patients, you can hit this button, and basically all that happens is Luna will call you, or the documentation services will call you, and you can provide information on what the patient says. And like you said, it's in a soap note format, so you can just go step by step, and you can manually add all these notes that you just did from the previous patient. And so it makes it easy. So you just saw a patient at 11, ends at 11:45. You got a patient at 12:15 or 12:30. You go and see the next patient, but then you have, I suggest getting some good headphones so that way you can do documentation in your ears while you're driving or doing something else. And at the end of that, then you can do your documentation in between patients. You don't have to worry about it at the end of the day, and you have whatever you want to do. And again, the concierge will look at your documentation and they'll send you the soap note, so you can either look at it if you want to edit anything. Say you said something wrong, because editing out loud at first is kind of awkward, and then once you get used to it, you can kind of understand like, okay, that was a good one, you can just sign off on it and so forth.
Yeah.
And
You get the doctor level privileges. You just pick up the phone and dictate your charts, and it's getting done. So awesome. Well, thank you, Michael. I think that was a great breakdown. And fundamentally, intake forms, charting, exercises, also having that integrated into the Luna app just kind of completes the picture. So we also wanted to give a very integrated experience. We wanted our patients to not have multiple logins, or therapists to not have multiple logins, emailing things, calling patients, having information stored in different spaces. So I think that kind of seamless approach was also a foundational important piece for Luna, which is to keep that experience really integrated versus having lots of different platforms, lots of different logins for our therapists.
Yeah. And do you believe concierge is the future of PT, or do you feel like there's always going to be this blend of in-person like clinic or and then like at home PT? Because I've had patients ask me like, "Oh, do you guys have a clinic?" And I'm like, "No, we don't." And they're like, "That's strange." And it's like, "Well, is it though?" Because it's kind of cool. So I guess what's your take on the future of physical therapy in this sense?
Yeah, I mean, I think that all different models of care are important, but and I think keeping the focus on the higher level goal, which is improving access, is pretty critical,
Mm.
right? I mean, what is the future of physical therapy? Something that improves utilization of physical therapy, right? Because there is so much need of physical therapy, but patients are not getting access to it. May it be due to payer limitations, may it be due to convenience limitations. So I think at Luna, our goal is to be a part of that important role of improving utilization for our patients. And while in clinic is kind of beneficial for patients that need heavy machinery or technology that cannot be in your home, 87% of those patients can be seen at home, right? So I think that our understanding is that in the future, this is not concierge PT. It is concierge level experience. You're getting a white glove experience, but it's still in-person at home PT, right? So outpatient PT at home, outpatient PT in the clinic. And I think that outpatient PT at home is not going anywhere because patients love it. Patients are getting better. We recently published a white paper last year that demonstrated the outcomes that Luna therapists are bringing and how the outcomes of our patients are. And they're better, if not the same, as compared to in-clinic care. We're solving, access issues and better outcomes for a lot of surgeons and their practices and post-surgical care. We're improving utilization of outpatient PT over home health physical therapy for patients that don't necessarily need nursing and occupational therapy, and it's leading to a lot of cost savings for the payers. So I think we're solving very high level problems in our industry today. So what does the future of physical therapy look like? We absolutely see outpatient PT at home as an integral part of it, but how do we do it best? And I think you really need a platform like Luna to do that.
Yeah, what would you say the biggest difference between like typical like traditional home health and outpatient PT at home is?
Yeah, I mean, I think the most important thing is how they're set up, right? So Luna is an outpatient PT setup. It's not a home health agency. So we don't have nursing, we don't have occupational therapy. It's just like going to an outpatient clinic, except that the therapist brings the clinic to you instead of you go as a patient going to a clinic. So that is the fundamental difference. It's just the way it is established and then the services that are provided. So the services provided by outpatient clinics are what you will get by Luna, which is at home.
And I've seen Luna's collaborated, and you've mentioned this earlier with other providers. I saw more recently with Baylor. And how is Luna integrating within the communities that they're starting to go into different cities?
Right. So wow, that's one example. But Luna today is in 19 states and 32 metro markets across the country. So definitely, I think business development and market expansions are the business aspect of the company. And at the end of the day, it's about doing that efficiently. So I think we now have a really good process and an exceptional team at Luna that does market expansions and business development with different health systems, different orthopedic groups. And they're bringing this value to these systems that understand the need. And we recently did a referral leakage report. And just to share with everybody, what that really means is when you are a clinic, and or a health system or a surgeon, patients are coming to you because they think you're a great surgeon. But what about the post aftercare? right? And there's no reliability or consistency or standardization of that experience once you've had your surgery and then you're going to any PT clinic that is around you. So, what we really wanted to do is provide this great experience and standardization of care experience for those surgeons, for those orthopedic groups. And that referral leakage report basically showed that when a patient comes to a doctor, then they go away, they're out of their system. But by partnering with Luna and these health system partnerships and orthopedic group partnerships, the patients stay within their system and they're able to receive the same extended standardization of care by knowing. And the surgeon doesn't have to remember, oh, where do you live as a patient? Okay, what are the PT clinics in your area? The
Mhm.
patients get referred to Luna, and Luna has the high quality standards across all metro markets and all states. So they feel strongly about being able to enable great quality care outside the four walls of their hospital or their clinic locations.
Yeah, I've certainly seen a consistency with some surgeons around the area, and it's like I, know the doctors by name now, so it's just like, oh, who's your surgeon? Oh, okay, it's this one, and then or it's not that one, and then it's this one. So I think it's been good in the sense of just understanding like who the doctors are in the area and building a sense of community of knowing where your patients are going and who they're seeing, and then developing a relationship with that. I think is good, and it makes the patient feel better because they know that you've already seen somebody like them before.
Absolutely. And the Luna Pathways feature has been an integral part to it. So, it's really important as a therapist, like while you know that who the two surgeons are, it's sometimes difficult to remember who the surgeons are, what their preferences are. And we need that liaison of communication. So at Luna, we have this ability and this feature where you would know as a therapist, oh, this surgeon has these preferences. And some of the preferences are remarkable, right? We've all worked with surgeons who are very, very specific. And we have a surgeon who said, no pajamas or slippers when you're treating my patient at home. And that actually goes in your app. Your doctor's really, it's really important to this patient's surgeon that they want that kind of environment to push them out of the home comfort. So it's important that that gets communicated to you. You would never know. And then similarly, the escalations piece. What do you do when you're at home and your patient's showing signs of DVT? And what we want to do is through the app communicate the surgeon's preferences on how to escalate that. So again, another really great example of how to improve, operational efficiency and improve our therapist experience by knowing what is where and how do we solve these problems and where do I call when I have an issue. So I think all of that's really key to keep us successful when we're out there treating patients.
Yeah, and we've been talking about the operations in regards to just what Luna is and where it's going, and I think this is fantastic because I think for people to get behind a company, they have to understand what they are and how they operate. But for people who are listening, maybe they're therapists and they're like, okay, I want to get started with Luna. What are the steps, I guess, to get started, and what is the onboarding process in that regard?
I know you want to share your story. I mean, I can piggyback on you, but how did it go for you? I think it's a very seamless process. So I'm happy to share. But do you want to share your story? How it came around?
Yeah, I'm not sure if anything's changed because I mean, it's been a year and a half, a little over a year and a half now when I started in regards to the onboarding process. But, I found Luna through a friend, and believe it or not, I'm in California in the Bay Area here, and I had taken a travel contract. And when the pandemic hit, the patient caseload dropped. So I had lost my contract that was supposed to go from January till May. And so March kind of pushed me back in patient caseload, so I didn't have any patients anymore. So I had heard from Luna. I had just signed up for it, and I had called the Luna number, and then they had an onboarding process where you go through a simple slideshow just explaining like the documentation, how you're going to be doing things, and so on and so forth. And then they also send you a care package, which we can kind of get into as well. And it included like a blood pressure taker, and included like resistance bands, and included goniometer, a bag, and many other things that kind of you need to basically run a clinic, in the simplest terms, right? Like it didn't give you like 30-pound dumbbells, but it gave you at least the simple tools that you needed to be successful. And so the other thing you needed to get was a table. And so I bought my table, and they give you, and then Luna provides a cover for your table, so you can go to patients' houses and stuff. So, and then I got started in April, and it was a little slower in the beginning because there's pandemic wise, and building a caseload always takes a little bit of time. But then I slowly developed more and more patients, and I've been full time since, and I've been seeing quite a few patients, as you know. So I see quite a few patients here and there, and it's been good to manage that. But the onboarding process was pretty simple and seamless in regards to that. And I think, I've learned a lot along the way from the beginning and just like little nuances. But from the get-go, I think they gave me the tools to understand like what I'm doing in my role.
Yeah, that's perfect. And that's our goal. Honestly, onboarding and getting on Luna's platform is actually a very, very streamlined process. And we have some dedicated, fantastic teams to do it, right? So we have an amazing therapist acquisition team. So you could reach out to Luna at any time. And we actually have amazing therapists on our therapist acquisition team, because that's, I think, how we resonate with understanding how do we solve our problems. So we I think Emily, Ashley, Naseem, I think we have some really great people on our acquisition team that are able to connect with you, share with you the message and how things happen at Luna in a very, very streamlined, efficient manner. Once you sign up with Luna, it's actually pretty seamless in order of the onboarding process as well. It's a self-paced onboarding process through the app called Lunaversity. And we've designed some tutorials and some onboarding material to help you get started. And so once you finish that, credentialing's done all in-house by Luna for you once you provide all the paperwork. But it can happen as quickly as in a week, and you can actually be starting to treat patients. So it's very easy if you have any interest. I think it's really awesome as a platform for a therapist to kind of go explore, learn what's happening in the innovative world of delivering care, get yourself some flexibility and some amazing technology tools. So yeah, and I think once you are finished with credentialing, as you mentioned, we want to give a welcome PT kit. So if you're a PT who've never done outpatient PT at home, what do you need in your backpack to get up and go and start treating your patients? So I think that was the critical piece. It has things from, assessment tools, things that you would want in a fanny pack, like, a goniometer and the pulse oximeter and the blood pressure monitor, all that. And then some treatment tools. So things that are portable, things that are easy. And then also the infection control supplies. So I think all of that kind of comes in this really awesome backpack. And then all our therapists actually also bring a treatment table and a treatment table bag. So we're not treating our patients on the floor and the couch and the bed. We want a professional work environment. So I think it's really critical that we take that ownership of creating a professional work environment and a professional relationship with our patients when we're treating them at home once or twice a week for a few weeks, So I think it's a very seamless process, or it's an awesome team here to support every therapist who is interested. And yeah, feel free to reach out to us anytime.
Yeah. And like she said, it took me about a week to get from like the starting the videos and then getting right on to seeing my first patient. I think it was April 2nd was my first patient. So it wasn't long at all, which is great. But I guess in Luna has expanded so much, and it's starting to provide quality care of everywhere. And I guess are there I want to play devil's advocate because I know the platform is so great, but are there limitations to Luna? And what are you guys doing to work on some of those limitations, perhaps?
Great question. I think the limitations are that there is a big need, and there is only how quickly you can evolve. So I think that the most important thing, and I don't know, that's a good question. In terms of limitations, I think we're really focused on listening to our customers. We're really focused on listening to our patients, listening to our therapists, listening to our physicians. And I think the biggest challenge is to ensure that you're always on your A game all the time, right? I think that's the beauty of this, but at the same time, that's the challenge. So while we overcome our limitations, the most important thing is understanding and recognizing and listening to our customers' needs and making sure that we're doing it at the same pace as we're scaling and we're growing. I think that's the key aspect of it.
For sure. Yeah. And I think overall, I haven't had many limitations whatsoever in regards to just feeling that I'm not ready to go into a patient's house. And I think Luna has done a good job because you're able to message someone right immediately through your own app. So the patient has their own app, and then you have your own app as well, and you can see all your documentation and everything in there. So it's very easy. Even if you do have a question or there's something that you get confused about, you can easily message the clinical team, or you can message, scheduling. You can message anybody in there to try and resolve an issue that you may have an issue with. And the other thing too is if you have, perhaps you're in an uncomfortable situation with a patient, they also provide feedback, or at least follow up, to make sure that you've like left the area, make sure you're okay, and make sure your safety is a priority.
Yeah, well, thanks for sharing that. Absolutely. I think that um, the key piece, as I was mentioning earlier, is that integrated approach.
Mhm.
Think that you are running your practice and you have the entire administrative team behind you. You need some marketing tools? Here you go. Market yourself in your community. You want some scheduling administrative help? Here you go. We have the amazing concierge team. You have clinical questions on discharging your patients, challenges, overutilization, patients who don't want to get done with physical therapy. Reach out to the clinical team and we're here to provide, peer inputs and things of that sort. So I think it's about bringing that perspective, a transition in mindset as to how can we change how we provide care, and what are the platforms that are what is the platform providing you in order for you to do that best. And then absolutely on the patient side, it's really critical. The patients do have the app. The amazing thing, there's so much talk about, along with telehealth, there's also remote patient monitoring. And I think this exercise component of the Luna app, we talk about it being therapist prescribed and monitored. And what that really means is once you've provided exercises to your patient, if they have they're kind of marking their pain level every time they do their workout. We have a little gamification in the app. So if you give them exercises, you have a little sapling. And then if you set the cadence as doing it 3 times a week and your patient does it 3 times a week, their tree starts growing and they start having fruits. And then if they don't do their exercises, the trees wilt. So I think, how do you add some of those engagement components? If their pain level becomes an 8 on 10, the therapist gets notified and you can monitor that and modify those exercises remotely. So how do you bring that skilled person, that skilled therapist, to provide that even in an extended manner as compared to only when that patient comes in front of you for those 30 minutes in a clinic? I think just as a therapist, for me to have that ability to bring that higher level of quality care to my patients just makes me excited about doing it this way versus being limited in a brick and mortar clinic kind of environment.
For sure. Yeah. And again, it's providing quality care at people's homes, and patients just understand, like, not even understanding that it was a thing before, and they're like, this is fantastic, I don't know why this wasn't a thing before. So but I wanted to know more about Luna in regards to the future. I guess, what are you excited about Luna's future, and are there things on the horizon for Luna that we may want to know about?
Well, we're in 32 markets. We're going to be in 36 very soon, actually, before the end of the year. So, if you're a PT that you're excited about and we're not in your state, stay tuned. It's coming. So, definitely, I think scaling across the country is a part of it. We are really excited about, we've received so much interest about occupational therapy and speech therapy. So, we're definitely evaluating that offering to incorporate that along with physical therapy. And then, yeah, I mean, I think making sure that some of these amazing health system partnerships that we have evolved, the orthopedic group partnerships that we have evolved, are going to play a big role in, how we're solving, real life issues and that industry problem. So it's about collaborating and creating that integral workflow between surgeons, physicians, health systems, patients, therapists, and creating it, at the next level that's really hard to beat. So I think that's definitely what's on our horizon.
I'm certainly excited for the future of Luna, and at least my role in working with them as well. And so, but I know you were kind of short. We are running out of time here, and I kind of want to close out with some final questions if you're ready for them.
I am ready. I'm
All
ready.
right. So this is the Health Me to Health You closing remarks. The first question is, if you had the attention of everyone in the world for 30 seconds, what would you say?
Well, I would say listen to yourself. Never think there is something you can't do, because you can do what you want to do if you want to do it. And then your voice matters. So make sure that you speak up. What you know, maybe the other person doesn't know. So I would say listen to yourself, share your voice, and always remember there's nothing you cannot do.
So powerful. Second question, what book do you recommend, whether a book you're reading now or in the past?
I wish I had a great book to share that I'm reading now, but a good book that I did read was the Michelle Obama's book. And I think that the other, like a nerdy book that I'm reading right now is called Storytelling with Data, because I'm
Mm.
enjoying data myself. So I think both of those are good for all the PTs out there.
Third question, last question. Where can people learn more about Luna and from you?
Getluna.com. And I'm always available if anybody wants to connect. I'm on LinkedIn. Feel free to reach out. And yes, getluna.com. And the number to call would be on the website. So please reach out, and we'd love to share the message with you if you're interested.
Palak, thank you so much for coming on the podcast. I really appreciate it.
Likewise, thanks for hosting.
Of course, no problem.